She called me from a parking lot. It was a Tuesday afternoon, and Dorothy had just walked out of her grocery store, a place she'd been going to for 30 years, and she couldn't remember where she parked her car. Not just for a minute, for 45 minutes. She sat on a bench outside the entrance, watching people come and go, trying to breathe, telling herself it was nothing. Her daughter found her there. That was the moment everything changed. Dorothy was 67. She had high blood pressure and had for years. Her doctor had told her to watch her salt, take her medication, come in every 6 months. She was doing everything right, or so she thought. I'm Dr. Sarah Jenkins. I practice integrative medicine here in Austin, Texas, and I've spent the last 18 years working specifically with patients over 60 on brain health and memory. In that time, I've sat across from hundreds of patients just like Dorothy, men and women who were managing their blood pressure numbers on paper, while something much more serious was quietly happening inside their heads. That's what I want to talk to you about today, because if you are over 60 and you have high blood pressure, even controlled blood pressure, there is something your doctor may not be telling you, not because they don't care, but because most of us were never trained to connect these two things the way the research now demands we do. Here's what I need you to understand from the very beginning. High blood pressure is not just a heart problem. It is a brain problem, and the damage it causes doesn't always announce itself with a dramatic event. It creeps in quietly, over years, while you're living your life. There's a term researchers use, cerebral small vessel disease. It sounds technical, but the concept is devastating in its simplicity. Every time your blood pressure spikes, even briefly, even if it comes back down, the tiny capillaries that feed your brain are under stress. Over time, those vessels stiffen, they narrow. Some of them develop tiny lesions, and the parts of your brain they were supposed to nourish begin to shrink. A landmark study published in the journal Hypertension found that people with high blood pressure showed measurable reductions in brain volume compared to those with normal pressure. And this was happening as early as their 50s and 60s, long before any obvious symptoms. We're not talking about strokes. We're talking about a slow, silent erosion of the tissue, responsible for memory, decision-making, and processing speed. The part that keeps me up at night is this. Most people don't feel it happening. You don't wake up one morning and think, my brain got smaller today. You just notice that names are harder to find, that you read a paragraph and have to read it again. The conversations feel harder to follow in noisy rooms, that you walk into a kitchen and forget why. You chalk it up to age. Everyone around you does too. But it isn't just age. In many cases, it is pressure-driven brain damage that was building for years. And here is where I have to be direct with you, because I care too much to sugarcoat this. Controlling your blood pressure number is necessary, but it is not sufficient to protect your brain. The damage that's already been done to those tiny vessels does not automatically reverse when your numbers improve. The inflammation that accumulates in brain tissue doesn't just disappear because your prescription is working. The neurological support your brain needs to repair and regenerate requires something more, something that reaches into the cellular environment of the brain itself. That's the gap. And that gap is where I've spent years of my clinical research, because I kept watching patients come in with perfect blood pressure logs and still declining cognitively. Something was missing, and I refused to accept that there was nothing we could do about it. I want to pause here for one moment. If what I'm describing sounds familiar, if you've been noticing small changes in your memory or clarity, I don't want you to leave this video without checking the pinned comment below. I've left something important there. We'll get to it. But keep watching, because the next part matters even more. What I discovered after years of digging into the neuroscience is that the brain has its own repair system, and it is exquisitely sensitive to the chemical environment it lives in. There are specific compounds, some botanical, some derived from nutrients your body already knows, that can cross what's called the blood-brain barrier and directly support the microvascular health of brain tissue. They reduce oxidative stress in neural cells. They support the regrowth of tiny capillaries through a process called angiogenesis. They calm the neuroinflammation that silently accelerates cognitive decline. These aren't fringe ideas. They're published. They're studied. The problem is that nobody is connecting the dots for the patient sitting in the chair. You get your blood pressure pill and a pamphlet about sodium. You don't get the conversation about what your brain needs after the damage has started. That's the conversation I want to have with you right now. There's one compound I became particularly focused on, a form of vinpocetine derived from the periwinkle plant that has been studied specifically for its ability to improve blood flow in cerebral microvessels. In patients with small vessel disease, it's shown measurable improvement in cognitive processing speed and memory retrieval. Combined with lion's mane mushroom, which stimulates nerve growth factor, essentially encouraging your brain to repair and rebuild, and nattokinase, a natural enzyme that supports healthy blood viscosity and reduces the microclots that form in compromised vessels, you begin to have a protocol that doesn't just manage blood pressure. It supports the brain that has been living under that pressure for years. I want to tell you about Carol. She's 71, lives in Arizona, and came to me after her neurologist mentioned early white matter changes on her MRI, which is imaging language for exactly what I described earlier. She was terrified. She had controlled blood pressure for a decade and couldn't understand how this had happened. We worked together on a comprehensive protocol that included targeted nutritional support for cerebrovascular health. 6 months later, her follow-up cognitive assessment showed meaningful improvement in verbal memory and processing speed. She told me, and this still moves me, she said, "I feel like the fog is lifting." Linda, 68, from Tennessee, reached out after watching one of my earlier videos. She had been on blood pressure medication for 8 years and was experiencing what she described as word fog, that frustrating moment when the word you want just disappears. She was embarrassed to talk about it with her family. After adding targeted brain-supportive nutrients to her daily routine, she told me that within weeks she noticed she was finishing sentences without that catch in her throat. Her husband noticed before she did. Barbara is 74, from Virginia, and she is one of the most determined women I've ever met. She came to me after her husband passed away. And grief, I need to mention, is one of the most powerful accelerants of cognitive decline we know of. High cortisol from prolonged stress literally damages the hippocampus, the part of your brain most responsible for new memory formation. Barbara had blood pressure, grief, and a brain that was struggling. We didn't give up on her, and she didn't give up on herself. Today, she volunteers at her local library 3 mornings a week and says her mind feels sharper than it did at 65. These are not miraculous stories. They are what happens when we stop treating blood pressure as a number on a cuff and start treating the human brain that lives behind it. Now, I've spent years researching the exact mechanism I described today: the microvascular damage, the neuroinflammation, the cellular environment that either supports or abandons your brain's ability to repair. And after working through the literature and trialing various combinations in my practice, I found a formula that brings together the precise compounds I believe matter most for this specific problem. It's called the Brain Song. I don't share this as a product recommendation. I share it the way I would share anything I discovered after years of looking. The way I'd lean across my desk and say to a patient, "I found something I think could help you." I don't want you to leave today without knowing it exists. If you're over 60, if you have blood pressure concerns, if you've noticed even small changes in your clarity or memory, this is worth your attention. The link is in the pinned comment below this video. That's where I've put it, because I want it to be easy to find. Here's what I want you to take away from everything we talked about today. Blood pressure doesn't just threaten your heart. It is quietly, steadily reshaping your brain. The changes are often invisible until they aren't. And waiting for a diagnosis before taking action is the most expensive mistake I see in my practice. Not financially, cognitively. Because the brain can repair, but it needs the right support to do it, and it needs that support before the window closes. You are not too old to act on this. Dorothy parked her car today without a second thought. She told me recently that she feels like herself again, really herself, for the first time in years. That's what's possible when we stop accepting managed as the same thing as protected. Go to the pinned comment right now. I've left the link to the Brain Song there, along with a note about what I recommend and why. Read it. Take it seriously. Your brain has been working hard for you for over 60 years. It deserves the same in return.